So I'm here today with Brittney. Brittney is one of our front office staff workers. She's an amazing worker for us. And she is consulting today for a Mommy Makeover, which is a term for a combination of procedures in which we are correcting the things that babies have changed on us. And so we're definitely going to do something with her breasts and her abdomen and do some liposuction somewhere. So I know that she feels that her breasts are smaller than she would like them to be and sagging, and also she has excess skin and a stretched out abdominal wall from the pregnancy. So we're going to talk about those procedures. And I know she also feels like she has some excess fat of her hip, so that's going to be part of our procedure. So basically, we're going to do this procedure at Baptist Hospital, and the surgery itself is going to take about 4 hours. We're going to start by, I will see you that morning, and we are going to do some markings on you, and then you will go back to surgery and be put to sleep, general anesthesia, and then we will place you where you're laying on your stomach, because we're going to start off by doing that liposuction of your hips first. So the way that is performed is we do small little tiny stab incisions in your upper buttock area, and we will inject both your hips with what we call tumescent fluid, which is IV fluid mixed with lidocaine and epinephrine. And the fluid is going to fill the spaces up to allow our cannula to glide better. The lidocaine will give you some numbing, and the epinephrine will cause the blood vessels in the area to constrict so that you have less blood flow to the area and therefore have less blood loss, along with less bruising afterwards. Then we're going to take our liposuction cannula, where I use power-assisted liposuction, where the handpiece vibrates about 4,000 times a minute. So it's just going to do this and break the fat up as we go, making it easier to suck the fat out. Right amount of fat. We will close those 2 small incisions with 1 or 2 little absorbable stitches. We'll put dressings on, and then we're going to flip you back over to start on the front side, and you'll be asleep for all of this. So once we get to the front side, we're going to start with your breasts. The first part of that is to place the implants, and we're going to start with an incision in the fold under the breast, and we're going to place those implants under the muscle. Then we're going to take our breasts and lift them back up onto the chest wall where they belong. And the way we do that is we're going to remove a portion of skin from the central part of the breast, and then we elevate the remaining skin up so that we now have a space up higher to place our breast, and then we will take the breast and put it up where it belongs and close with that smaller, tighter skin envelope. Also bringing the nipple and the areola up into a more elevated position, and we will reduce the size of the areola as well. When we get done, we end up with a scar around the areola, a scar straight down from the areola to the fold, and a scar in the fold under the breast. We're going to close everything up with absorbable stitches and put tape and a dressing on. And then we're going to move on to our tummy tuck. The tummy tuck is what I call the rate limiting procedure of this whole combination, and it is because it is one of the most painful procedures that we do, and causes you to have a little bit more of the downtime than the other 2 would. Something that we are offering to patients now is a tap walk, which, if that is what happens, is that is done when you come into the OR room and you go to sleep. The anesthesiologist will come in and they will block this area, and that lasts for several days. So it definitely helps with your postoperative recovery and how you feel those first few days. And I think it helps with the long term too, because if you don't ever get into that cycle of pain that you initially have for those few days, you'll feel a lot better overall. And then what we're going to do is we make an incision down low that goes from hip bone to hip bone. We're going to elevate the skin and fat up off of the abdominal wall up to the belly button. We cut around the belly button, but we'll leave it attached because we are using your same belly button. It's just going to come up into a more different position on the skin, because this part of that lower skin is getting removed. Then we keep going with our elevation up to the breast. We then are able, through this one incision, we can lift everything up, see that entire abdominal wall. Because the next thing we want to do is tighten it. So we will do 2 rows of stitches from the top to bottom. You have your central 6-pack muscles here, and there's a very thin but strong layer of tissue that covers that. We're going to take a bite suture here and a bite here and tie it. So what happens is, I like to say it's like lacing up a corset and tying it. We're going to bring that waistline in and flatten the abdomen out with those 2 rows of stitches. The next part is then we're going to sit the back of the table up. And as you know, when you're sitting here, you can grab more extra tissue than when you're lying flat. So in that seated position, we will take that loose skin flap and stretch it all the way down. We will cut off the extra, and then we'll go up underneath and see where the belly button is sitting and where it wants to come straight up to where the skin is now. Make a little circular opening, sew it into place, and close here. Prior to closing, I have been applying a powder called Celerate, which is something that causes coagulation of the area. And we have been noticing a lot less fluid coming out from the drains, which has been allowing us to remove the drains sooner, and also lowers our risk for postoperative seroma, which is just a fluid collection that can occur after the drains come out. So we would do that prior to closing and placing the 2 drains. Afterwards, after we've closed, we will put dressings there. You're going to have a support bra here. You're going to have a support binder here, which will take care of where we've done suctioning, take care of the abdominoplasty, and then you will be woken up and taken to recovery.